Hi, everybody, and welcome to the 12th episode of The Brain Function from the Togetherness Media Los Angeles. This is Dr. Nami, and I'm about to talk about another important thing, memory. And I'm sharing with you some domains of our memory function, what happens to them if I'm just, kind of subjectively complaining about memory problem. Is that really significant? Do I need to really worry about the incidence of Alzheimer's if I had the family history for that? This is not only about the elderly population, especially these days that we're having the COVID brain. We see that many middle-aged people or youngsters even, they are complaining about some degrees of memory impairment. But how important is that? At what level do I need to get concerned and see a doctor for that memory loss? So we might be worried about our mental sharpness, right? Or we might be worried about that of a loved one. So mind forgetfulness or mind senescent forgetfulness is a benign form of forgetting things. So, for example, if I have trouble remembering someone's name, but remembering the person's name after a while, that is not a big thing. So it is not serious memory problem, apparently. But if memory problem are seriously affecting my daily life, or I'm not functioning well like I used to do before, then it could be early sign of dementia. And we know that one of the most prevalent types of dementias is Alzheimer's type dementia. So we got to be kind of worried about this. If things are not really going well, and I do have family history for that, I'm not following the brain-friendly lifestyle habits. I'm smoking, I'm drinking too much alcohol, I have, my anxiety management or stress control is all over the place, and I do not sleep well, I'm not following sleep hygiene and healthy habits for my sleep. And I eat too much fast food, or I have a sedentary life, I'm not moving around, or my physical activity is not really favorable. So these are the things that puts me at a higher risk for developing dementia or developing significant memory loss. So before we concern about our memory problems, we need to ask sometimes some tough questions from ourselves. For instance, the memory problem, memory loss is the most common symptom. And I need to ask myself if I easily forget information that I just learned, or do I lose the track of important dates and names or events? And do I forget big things if it happened? Do I ask for same information over and over again, or do I rely heavily on the memory aid like Post-it notes or reminders on my smartphone? So these are the things. If the people have problems in planning and their problem solving, and they have issues with with keeping a track of their bills or balance their checkbooks and something like that, this is also something significant. And another domain that we got to be having open eyes on is the daily task and the challenges that we're facing. So if we forget the rules of the favorite games that we're playing, or we have problems in driving to the place that we often drive to, this is something that we need to take care of that, and also we need to consult a doctor or a psychologist for it. And at times and places are confusing for me. If that is the case, then we should take care of it. Also, changes in the vision. For instance, some of the people, they complain about the problem that they find it harder to read the words on the page, or they have trouble judging the distance, or they cannot tell the colors apart. It's important because it is affecting our driving, and eye is a part of the central nervous system. The retina is a part of the brain. And when we have some issues with the brain function, then one of the presentations of the brain dysfunction might be vision problem. And if we have issues with our verbal communication, like words and conversations are frustrating for us, we got problem with the vocabulary, and that becomes hard for us. We cannot find a right word we're looking for, and that happens over and over again. That's like the order of the day. So it's very frequently happening, and I lose the track of my conversations, and the conversations might be struggling for me. And I would avoid joining in conversations. And I suddenly stop in the middle of a discussion because I don't know what to say, or we keep repeating ourselves. We don't know exactly what sort of discussion we're following. And if we lose things very frequently, if we misplace the objects, if we're wandering about, this is also, if it is really frequently happening, that is something for certain. So there's a red flag, and we need to take care of that. We need to discuss this with our psychologist or neuroscientist or our clinical expert. Some people, they do have lapses in their judgment. For instance, they have problem with decision making, and they may have poor decisions lately, or they make mistakes with money, and they give away money not in a normal way. And also sometimes when they are going to plan for the sequential motor functions, like something to do manually, then they find it really difficult. And in some instances, people with earlier stages of dementia, of Alzheimer's type, they start to have social withdrawal symptoms. So they're just scaling back on projects at work and are less involved with the favorite hobbies. And they lose their motivations, and they find themselves like watching TV or sleeping more than usual, right? And it got mood changes. They got upset more easily. They feel depressed or scared or anxious, and they just, drive up the wall and lose temper very easily. They throw the objects, they cuss, and also they might become suspicious of the people. So the abnormal behaviors. So these are the bunch of the symptoms that people with significant memory and cognitive decline may come up with. Otherwise, we're doing fine. So if someone goes to a doctor's office and says, doctor, I'm so concerned about my memory problem. I'm so worried that I wouldn't get Alzheimer's disease. That person is predominantly doing fine. But if this person is not aware of the extent of the problem, but the family members are taking that person to a doctor, and the person does not have an insight about the memory loss, then something is really big, something big really happening there. So if you are, willing to check about your memory function, I would suggest a specific website. So this is one made by one of the, valid sources in the USA. You just need to go and log into a website called Apollo Health. It's spelled like APOLLO Health. And then you check for CQ, which stands for cognitive quotient. Then by evaluating your cognitive quotient, if the website and the result of that evaluation is going to suggest you as something not right is there, then you got to be seeing a doctor or psychologist to better understand about the extent of the problem that you might be facing. So think about brain-friendly lifestyle habits, and take care of your sleep, your physical activity. Do not eat too much fast food. Stay away from smoking and alcohol as much as you can. And also let's enhance our capacity and our skills for stress and anxiety management. I hope you're doing just fine, and we'll catch up later in the following episodes of our talks. Thanks very much for tuning in.